Good evening, good evening, good evening, and welcome to Couch Conversations with the Doctors, where health is wealth. What night is it tonight? It is Monday night, and it is time for Couch Conversations with the Doctors. As always, we're going to go around our great esteemed panel and introduce some people. But before you get to texting me and asking me about some people who may be missing, I just want to make sure that we ask all of our viewers to keep Dr. Mason in his prayers in his hour of bereavement right now. He lost a family member, and we want to continue to keep him in our prayers. He will definitely probably be back with us on this Monday, but right now he is with family. Dr. Pete is out here somewhere and he is probably on his way. But while we're waiting on him to get here, we're going to go around and we're going to introduce all of our great panelists who are here. I want to say hey to Linda Johnson, who is here. She says good evening to everyone. To the Lillian family that is here with us. Hey, how are you? We are here and great. And I see you say we got a little late. It's okay. We are here and we are ready to get started. To the man who says that he is the Wolfgang Puck of food, he is that obesity specialist and that family practice medicine doctor, our very own Dr. Tony Hampton. Dr. Hampton?
Thank you, Nikki. Happy to be here, guys. I spend time with Advocate Health, encouraging people to eat well. As a family doctor, obesity doctor, doctor with some training in nutrition, I believe that food is medicine. And if we can convince more people of that, we will save many lives. So happy to be here tonight and looking forward to our discussion, Nikki. Thank you.
Outstanding, outstanding. To the doctor that's known on these streets as Dr. 100, that's our very own Dr. Maya Green. Dr. Green, 100,
Good
huh?
evening. 100, 100. Stand, keep it at 100. Good evening. Always a pleasure to be here. Thank you to the congressman. Thank you, Nikki, for having this forum for us to learn with and learn from community. And good evening to all my esteemed colleagues. Great to be here.
Outstanding, outstanding. Well, to the man who says that I threatened him to be here on Monday nights, but he is always on time, that's our very own Dr. James Miller. Dr. Miller.
Well, good evening, everybody. We're so happy to be here. I want to thank you, Nikki, and thank you, Congressman Davis, for providing this platform for us, to be able to discuss issues and concerns for the community. I am a retired internist, but still working on trying to heal our community in whatever way I'm able to today. So I'm here to do what I can and contribute what I can to the conversation. Thanks for having me.
Outstanding, and thank you. Well, to my colleague who tends to leave me and go and have fun in the sun, but I think the weather is just about the same right now, and that's our very own Dr. Douglas Graham. Dr. Graham?
Nikki, you might be right about that. I'm just like Dr. Miller. I'm a retired physician, but after retirement, I spent 2 years working for the congressman in his office in Washington, D.C. So I made the transition from the clinical practice to public policy or practice. It's really an honor to be here to work with my colleagues, and we're going to try and answer your questions as best we can.
Outstanding. And I want to say hey to two of our very special guests who are hanging out with us on tonight. Well, one really isn't a guest. She tends to pop in and pop out sometime. And that's our very own Miss Newkirk Sutton. I can't forget to say hello to her husband and her daughter because her husband always tells us that we forget that he's watching.
Yes, thank you so much. Thank you to the congressman, of course, you, Nikki, and our esteemed panel of doctors and public health professionals. I'm in great company and looking forward to the conversation tonight.
Outstanding. And to our very special guest for this evening, Miss Aisha Jaco from Westside United, the executive director there. And she has so many great programs going on. And her special sauce is she's a shoe queen. All right, Aisha.
Well, good evening, everyone. Nice to be in your company. Thank you again, Congressman Davis and Nikki, and to the doctors on the panel. Good to be with you. And to Tyrena, who's a colleague in this space and member of our Community Advisory Council. Good to be with you.
Outstanding. And to the man who makes this possible for us each and every Monday night, to the one who teaches us that true wealth is health. That's our very own Congressman of the 7th Congressional District, Congressman Danny K. Davis. Congressman?
Well, let me thank all of you because health is practically everything. I can't think of anything that is not a part of what I describe as health. I've been around it for a long time, since 1969, 70, when I took a job as the director of training for one of the community health centers on the west side of Chicago. I worked with that group, but I worked with another group before that group. And I've worked with other groups doing various things. I've functioned as a consultant. I've been a planner. I've traveled all over the United States, worked on Indian reservations, worked with grassroots organizations who wanted to start things that did not exist. And I've met some of the most wonderful and most decent people in the world who have brought things from where they were to where they are. And yet we've never had enough of anything that we needed in the way of research, in the way of treatment methodologies, in the way of resources. Oh, we keep climbing. I remember we used to always say at commencements that we climb though the rocks be rugged. And I think we keep doing that, Dr. Miller. But I think we're on the verge, right at the tip of some major breakthroughs in healthcare. Cures that we have not found before. Sickle cell is right there, just right there. A little more of a push, and perhaps we'll be over. But we are continuing to experience serious differences in infant mortality, infant morbidity, and deaths. African American women are still experiencing much more than lots of other women in the country. And so we thought we'd have a discussion. How do we keep changing that? How do we keep working on it? How do we get infant mortality erased in terms of the big gap that still exists? What causes it? What can we do to actually change it? So I'm ready to listen intently to what all of these professionals have to offer and suggest. So thank you for being with us, and hey, let's get it on.
Outstanding. We want to say hey to Laura Leone, who's here with us on this evening. She says, good evening to everyone. To Latrina Joshua, who is here. She says, I'm ready for the conversation. To Yolanda Williams and her family, who says, we are in the basement watching. Outstanding. To Lisa Lewis, Miranda Cooper, Lakeisha Simmons, and Pam Miller. Hey, Pam. Hey, Sister Miller. How are you? Who is here just as well. To LaRosa Anderson, who is here watching. To Pastor David Todd Whitley, who is here with us just as well. How are you, Pastor Whitley? To Kenneth Collins, who is here.
Bishop.
To the Chicago, I'm sorry. Oh, you're right. Bishop David Todd Whitley. To the Chicago West Side branch of the NAACP, I see that they have checked in and that they are watching just as well. To Greg Boggs, who is here with us. Melinda Maxwell, who is here with us just as well. And to Joe Dean, who is here. Thank you, Joe Dean, so much for checking in and always being here with us. Well, Tyrena, I'm going to hand the mantle to you. Why don't you get us started?
Absolutely. So I am very excited to be here talking about Black maternal child health, infant mortality, postpartum mortality. And so because we have some very esteemed doctors and professionals working in this space, I really wanted to kick off the conversation by first identifying that Black women especially are dying at an alarming rate from childbirth, as well as our infants are dying at an alarming rate within the first year of life. And we are hoping that this amazing think tank of people, we can start to unpeel what is contributing to this problem and where there needs to be intervention, what interventions have already been put in place, and how we can educate the community on those. So I think the first thing I want to do is ask one of the doctors to talk to us about what you believe is one of the contributing factors or some of the contributing factors to this crisis that we're facing. Who wants to jump in first?
Well, I'll take a small crack at this. I think there's problems with environmental justice, that they often live in communities that are disadvantaged in terms of pollution, whether it be in the air or in the water or in the buildings in which they live. There's cultural competency problems, and that many of the providers that they see may not understand how patients describe their symptoms. And this is one of the reasons why I think doulas are really critical in this community. There may be problems in terms of access to healthcare, because the distribution of primary care and specialists isn't uniform. It's rather non-uniform, and it's disadvantageous to them. There may be problems with transportation. They may not have access to public transportation to get them to and from the healthcare center. And there also may be pharmacy deserts. But in these communities, there's been a dropout of pharmacies, so it's hard for them to get formula and medications that they need. So those are some of the areas that just might be some of the reasons why we're seeing this problem.
Yes, Dr. Graham, many of you are already aware that we are losing 2 of our Walgreens over here on the West Side. And so when you talk about pharmacy deserts and healthcare access issues, I think that's a huge contributing factor. I know we have Aisha Jaco on here from Westside United, and she is a very good example of kind of bridging the gap between hospitals and care. And so I'd love to hear from you, Aisha, about how the programs and the hospital partnerships have been coming together around this issue.
Sure. So I'm fortunate to manage a collaboration of health systems that name and claim structural racism and historical disinvestment as key pillars and why we see a life expectancy gap to begin with. And if you layer that or look at the drivers of the gap, infant mortality is one. And to Dr. Graham's point, what he's outlined in terms of contributing factors are related to the social drivers. So we know that in Austin, that community has the highest rate of preterm births in the region. So our work focuses in the West Side. And so since 2018, between 2018 and 2022, that community had about over 800 preterm births. So for us, when we think about being responsive and reflective of the gap, one of the things that we did in partnership with the Westside NAACP, with Lurie Children's being a host of Westside Healthy Parents and Babies, is double down on wraparound supports for birthing parents. That do include doula supports, that does include enrollment to care, that does include lactation support, that does include wraparound supports for housing, transportation. So we know that if we're going to address this, number one, it is an all hands on deck approach. Secondly, there has to be an analysis of how we got here and a call out of the current state of the communities that we see these numbers in. And then there has to be investments, sustainable investments over time that have impact. So Tyrena, you and I had a beautiful moment back in April where we were at the launch of Westside Healthy Parents and Babies, and there was a young mother there who said, this was April, the baby was due in June, and she had not received care, right? She hadn't received care, and her issue when she felt comfortable enough to share her story, it was because this was her second baby, and she said during her first pregnancy, she felt like she was gonna die. So she just opted out of care altogether. So this was a miraculous moment. Nikki, you were there laying hands, praying, to get her. But by the end of that event, she went to get enrolled in care. And in June, she delivered a healthy baby. So there are hundreds of those mothers that we need to wrap our arms around. And that came out of NAACP saying, hey, you have access to systems. We need people that look like the community to implement the programs that you say you want to do. And then we've got to go to where the people are. And so we were able to activate that, and we need to see more of that.
I'll chime in real quick. In my experience as a family doctor is that the first part of my career, I worked at West Suburban and I trained at West Suburban in Oak Park, a hospital whose doors once faced the Austin community and whose doors now face the Oak Park community, which was intentional. And it was intentional because a lot of the resources that make the wheels of a hospital go don't come from the population that was in the Austin community in terms of the type of insurance they have, the type of patient you would see. So although that methodology didn't work for them, I learned as a family doctor who was delivering babies that the people who needed to receive that care was not being looked upon favorably. And a lot of that was economic. So when I think about solutions, the first thing that comes to my mind is the money. And I remember as a family doctor delivering babies, we were very busy. I got a great training there because a lot of the patients from the West Side who needed to have their babies delivered were not delivered by the specialists, the OB docs. They were delivered by the residents like myself back then. And great training, but the compensation for that patient was probably 25% of what the compensation is for the patients who were seeing that private insurance type patient for that specialist doctor. So I think for me, one of the barriers is the policies that allow or that lead to Medicaid being their primary tool and then not being able to see a doctor, because even in a large health system like Advocate Health, we lose money, honestly, when we see those patients. Now, we're not federally funded clinic like I was working for at Circle Family Care back in the day, but it's access to care. And if you have a system that looks negatively at a patient who has Medicaid, for example, with Houston, we have a problem. And what's ironic about that is that those patients have greater needs than a patient with private insurance many times. So one of the things we have to figure out is how do we create a model of healthcare where the Medicaid patient gets the same care as the private insurance patient. And I would even argue the Medicare patient has a higher compensation, so doctors are not pushing those patients away. So that's the first thing that comes to mind. The second thing is I think our health systems, which we're trying to do at Advocate Health, identify people who may need more resources. So that starts with asking the right questions. And then if that patient hopefully is comfortable answering those questions, we can then make sure that that resource is that extra resource is given, because many patients don't even know about these organizations that you guys represent. They don't even know they exist. They don't know what resources are available for them. And because of that, they never, ever get to the help they need. It's like a person applying for college where the tuition, like my kids went to WashU and you're paying 70 grand a year. A kid with less resources won't even apply, not recognizing that they have great scholarships for kids who don't have the money. They won't pay a penny in many cases, but they don't know, so they don't try. And so when you mentioned the young lady who hadn't gotten care, I know that for a lot of the patients I took care of, they didn't receive care because they thought maybe there's many reasons, but one of the reasons was not feeling they had access to it because of their limited resources. So the last thing I'll say real quick is that one of the things that I learned when I was doing research, when I did my fellowship for obstetrics at for maternal child health, we had to look at the research, and the research did suggest that when it comes to infant mortality and maternal mortality, one of the biggest drivers to them not having that high mortality was to simply have access to a community to support them. And once they're in a little bit of a community, which is cheaper, particularly nowadays with everything's like virtual these days. You could easily create a community of support. And then when one young lady is suffering or struggling, maybe somebody in that community can then, oh, by the way, you didn't know about this. Oh, by the way, this is how I dealt with this. So I think those types of, you have to, again, think about money when you're making these decisions. But if we could create communities of support and just kind of make that part of the process. By the way, when you start your journey as a future mom and a future father, here are some things we can wrap around you to support you. And while you're being supported, here are all the resources that you may or may not need. And that way we can get them the resources they need. And with that support, I think it'll change the outcomes because people don't realize what's out there. So we have to have things that are out there, but we have to know how to get people to that support.
Outstanding. Want to say hey to Audrey Jaycox, who's here. She says good evening to everyone. To Jackie Bright, who is here with us. Hey, Jackie, how are you? I see that Alderman Pat Dallas here with us just as well. Hey, Pat, how are you? To Sister Bonnie, who is here, she says this is good and thank you. Jackie Robinson Ivy says don't leave me out. Let the congressman know that I am here. Judge Marianne Jackson is here just as well. Hey, Judge, how are you? Want to say hey to Marcel Jackson. Well, Marcel, I might send you the link and tell you to pop in because you just had a new baby. And I know you have a story to tell. Want to say hey to Jackie over at the National Kidney Foundation, who's waving her hands and clapping and saying that I am glad for this conversation. We also have an anonymous comment. And the anonymous person says, thank you. Oh, before I read this comment, hey to the core center. We know you guys are here and you're all sitting around the table. And I know lately I have kind of been forgetting to say hey, and you guys have been sending me some nasty messages. So hey, core center, they are all at work, but they are watching. They are watching. And yes, we have not forgotten December 1st, and we're in the planning for World AIDS Day. So remember the core center. The anonymous comment says, I just want to take a moment to thank Congressman Davis for making sure that conversations are clear. We have real conversations on Monday nights. And I want to say thank you to the doctors who admit that we as patients sometimes suffer from insurance racism when we go to the doctor. Well, that's powerful. Well, Dr. Miller, it looks like you are itching to say something, but you just couldn't get in. So go right ahead.
I like to say, hey, Dr. Hampton and other members on the panel really talked a lot about the economics part of it. You know, when we approach a problem, we have to make certain that our approach is appropriate for the circumstances and the situation, because there are a lot of different kinds of elements that is going to be necessary to address this issue, and there's a lot of players that need to be involved in it, because I mean this is not just a hospital issue. This is a community issue, and we need to make certain that the community is well versed and educated on the issues that are there. You know, we often talk on this program about food, and if you're not, you know, if mom starts off not eating healthy, there's a beginning of a problem already, even before the pregnancy, and so that she takes that problem into the pregnancy, and and if she doesn't have the resources to do something to address that issue, then the other things in terms of you know, oftentimes patient would come in and we would say, okay, we're going to do your test, and then we're going to give you a set of things that we need for you to do in terms of follow-up. But do mom really have the resources? Does she have the support of family and other community people that can help her? Has she been, you know, as she grew, was she trained in terms of an understanding of what this process and this situation of pregnancy and the whole complexity of that being a mother and her health and now the health of another individual. How do you handle that? Because these are difficult issues and can be very overwhelming to someone who is in this not just for the first time, but you already got it. Some women who already have babies, and there's already an issue there with just taking care of those kids. So this is a very real complex problem, and we really need to figure out ways that, again, that we can make certain that we engage the community, all the aspects, whether it be a faith-based part of the community, whether it be just the neighbors in the community. We this is a problem for us all, the whole community. We all got to get involved with these issues. Otherwise, we don't really change them. We just keep going through the processes and we begin to look at it and deal with it as individuals. But no, this is a complex and continuous process that we have to figure out ways of involving the community and involving people before they enter these the issues of pregnancy.
Yeah, there was a time when birthing, especially in the Black community, happened in community. And I think that there have been so many efforts to identify ways that we can transition some of that birthing back into the community. So you look at a program like at the programmatic level, Westside Healthy Parents and Babies, Better Baby Zones, where we're providing that support and assistance. But even from a policy perspective, there's been just so much positive movement from the Black Caucus, from our advocates, our electeds, to create opportunities for birthing in a communal space. There is the new law that Medicaid has to cover doulas and care at birthing centers with no restrictions. So I think that that's a huge piece. It combines that economic piece with the programmatic piece, with the idea that we need to get back into a community space and provide that support system for people who are unfortunately giving birth and don't have that. They don't come to the table with that support system. So we are trying to create opportunities. I think our advocates in Illinois are trying to create those opportunities and put in the money where that challenge is, right? Putting their money where their mouth is when it comes to providing funding for certification for doula training. So building up that workforce, as well as providing funding and support for people who are lower income and receiving Medicaid to be able to access that level of support. So to answer those questions, right? I don't know how I should be navigating pregnancy. I don't know how what questions I should be asking my provider, because it is great to have a doctor, but if you don't know how to utilize that system of care, it's useless to be a part of it. And so I think that looking at opportunities to support our advocates who are fighting in that for us is also a call to action on how the community can get involved in helping the medical professionals, the public health advocates solve this issue. Everyday people can, make sure that they're voting in people and holding those people accountable for continuing this positive movement.
Yeah, I can remember living in a smaller community, and family when someone became pregnant, it was not an individual. It was a family matter. It was a community matter, and grandmothers and aunts became involved with this pregnant person, helping her to understand what it is that she's going to be facing, helping her to navigate this complex situation that she's in. And unfortunately, we've come to a time when seemingly we're not as cohesive as we used to be. Therefore, we don't interact. We don't have that kind of coming together and coming to each other's aid as we should. And we just got to figure out. I think we have to figure out, even if we got the other resources, if the resources are there and that person doesn't understand or know how to utilize them because they haven't been part of the system, it is still a new process, and it's still a difficult process. For someone who, for instance, hasn't really been involved with the medical facilities and the medical community because they otherwise been healthy, and just having to now engage in that, that can sometimes be frightening. It can be sometimes overwhelming with all, you go in and now they say, the doctor says this, and give you all these kinds of things. And now you got to take a bunch of medication, vitamins, and stuff that maybe has not been part of your life. And so I'm just saying we need to begin to look at this in a way that that help is there. And that help has to come from, because, the patient goes to visit her physician and he gives her instructions and the whole bit. But sometimes they need a helping hand on a regular basis, because these are just things that is difficult to navigate by yourself.
Let me add something real quick. I want to speak to the clinicians out there, because I remember when I worked in a ER as a young doctor at Mount Sinai, and I felt overwhelmed with wanting to help people, right? And you just wanted to save everybody. Rather, it was a person who came in who was shot at Mount Sinai Hospital and was on their way with the trauma surgeons to surgery, or just a young lady who came in with preterm labor symptoms, right? So to the clinicians out there, it's okay to feel overwhelmed. It's okay to want to fix everything, but you feel like you can't. It's okay being comfortable with being uncomfortable. But the good news is this, like, one thing I learned even with Advocate Healthcare, which is not Circle Family Care, is a different system, way more resources, is it was really our responsibility to understand that maybe we weren't really expert at everything we do. Maybe we needed a West Side organization to partner with to help us address some things that we didn't feel comfortable with. But what we absolutely could not do is not play a part in addressing those issues. We couldn't just say, well, you're not really part of our health system, so we'll just push you along to the federally funded health system that you came from. And what we have to do is to do whatever we can. And most of that is, in my opinion, knowing what's out there and then pointing people to those resources. But you can't just point them. You got to literally take their hand and walk them almost to the doorstep of that other resource. Because if you just point them, with so many things going on in people's lives, they are not going to make that their priority necessarily. So you have to let them know you care and that here's some resources. And then we work in collaboration with the people, just like we have a food pharmacy. Well, we don't know much about what the Chicago Food Depository does, but we know how to partner with them so we can give out food twice a month at many of our hospitals. So I just think being comfortable and with being overwhelmed and being a little uncomfortable being, that's okay. But we have to do more than that. And then if you're just a frontline clinician, you must demand from your health system that we come up with ways to support the people who have these special needs.
Want to say hey to Sharon Grant, who is here with us. Yolanda Williams is here. Virginia Knight is here. Sharon says, good evening to all. And Virginia says, good evening, everyone. Good to be back. It is good to have you back. Want to say hey to the group over at DLV Printing. Vernita says, Congressman, we are late going home every Monday because we don't want to risk missing couch conversations. So we all watch it as a group. So myself, my daughters, Keisha and Kalila, along with the rest of my family, my brother James, and our cousin Tanya, we stay at work an hour later to ensure that we are healthy over at DLV. So very good to DLV. So Tyrena, I know the congressman asked a question earlier. He said, what do we do? How do we get to the bottom of this? How do we begin to make some changes in this? I mean, you talked about policy and things that were done. And, I believe in following the money from A to Z.
Yes, absolutely. And so some things that have already began to happen that are in progress. There is some funding that was made available. Well, I know Governor Pritzker definitely put millions toward addressing this issue. And then, of course, we had our legislators ensuring that the insurance code got changed via public act to make sure that what the governor wanted to do could actually happen. Again, talk about implementation challenges. And I also wanted to just point out some of the funding that has been made available for existing doula organizations and birthing centers to be able to get the training and certification through Medicaid to begin to accept Medicaid training. So there was a lot of work and support put toward this issue. I think as we look to the future in terms of where we will, as advocates, as clinicians, community clinicians, which is what I love most about the doctors on this panel, is that they are community focused. What I think we need to continue to do, and what I've seen from starting to happen as well from Westside United, is how do we engage legislators in informing the community about these changes? Because most women don't know now that their Medicaid will allow them to get a doula. So ensuring, as a community org, my part is ensuring that the community is aware of these changes and how they might be able to benefit from these changes, and encouraging them to follow the policy, follow the money, and pay close attention to who we are selecting when we have that choice. Who we are selecting and their track record for prioritizing issues that impact us. And so those are some of the things that have already been happening and that are coming down the pipeline, at least from the perspective of the NAACP. And so
I understand that the NAACP just got another $1 million grant.
Yes, we are receiving funding. I wish it was for health, Congressman Davis, but we are receiving some funding to address community safety and violence and nonviolence. But we are hoping that we can get some support for a lot of the health things that we're doing.
Oh, I think the health things get a lot of support, especially maternal and child health.
Yes.
We just doubled the home visiting program over a 5-year period. Double. And the money started circulating week before last. $800 million.
Thank you so much, Congressman, for continuing to be a strong advocate and steward of all things public health as it relates to the state of Illinois, from direct impact down to economic development within health, and advocating for getting an increase in Black health professionals. So just wanted to, and all your community health worker legislation and funding absolutely has made a huge impact in just bridging that gap between that community health worker space, that doula space. I know that that's some of the work that's happening over at Westside United as well. So it's been a privilege to be able to see all of the work that you've been doing in the support.
Well, from the work, no, go right ahead. Go right ahead, Dr. Green.
Oh, I'd like to also just add a ask. This is gonna be one of them 100 moments, y'all. Okay. Historically, the infant mortality rate during slavery is 1.6 times that of white people. Today, that was during slavery, 1.6 times. Today, the Black infant mortality rate compared to white people is 2 to 3 times in the nation, and 5 to 6 times in Chicago. So the rates have actually increased compared to, since slavery. Okay. Now, what was going on? If you look at the structure, I'm glad you mentioned community. I'm glad you mentioned doulas. Doulas and midwives played a and I'm glad, Tony, you mentioned that when you said a lot of the births were happening in community. Dr. Miller, you also brought up the wisdom that was imparted from community members who have been through the process before, but those were also called granny midwives, granny doulas, things like that. And around the turn between the 19th and 20th century, there was a push to manage and I say this as a physician, okay, there was a push to, quote, better manage midwives by pushing them under Western medicine obstetrics, right? During that time, so if you look at the infant mortality rate from slavery to that point where we had the community births and the midwives and the doulas and were giving births in the community, right? Our rates actually went down, or to explain, got better. It was better for us when we were, I'm a Black person, so it was better for us during that time. And then there came the push to better manage or standardize care and push it all the way into obstetrics. I'm not saying obstetrics is bad. Do not call me. Okay. What I'm saying is that we have to move this back into the community. I got excited because I got, the state of Illinois, Illinois Department of Financial and Professional Regulation sent out a blast to people interested in joining the midwife board. You have to be a midwife, so that tells me there's some stuff going on in midwifery that's going to be good for our community. But with that, we have to look at culturally what was happening. That does not allow Black people to care, which, call the AMA. Literature shows that our community gets better care when it comes to someone from their community. Okay. Meaning African Americans have better health outcomes when they go to Black doctors or African American doctors, right? So with that push in the 19th to 20th century comes the envelopment of control and, quote, standardization to a culturated system that does not belong to Black people, does not serve Black people. And so we're doing all this spinning our wheels and we're like, what do we do? Well, there was an answer already, So my plea to Westside United, my plea to Tarina, my plea to everybody in here is, when we start to make all these changes and do all this work with the millions of dollars that Congressman Davis and all these other people have put into it, that we make sure that it's led by our people. And I'm not talking about, because, we can get Black doctors, Black OB doctors all day. You know what I'm saying? If they're not leading the organizations, we're going to keep having the same outcomes. We're going to, again, y'all know my bang. Then we're going to pay a white institution to do Black research, hire a white institution to be over Black bodies, and we're going to have the same outcome, right? And then we're going to pay another white institution to do research on it. We have to come to a place where we trust ourselves enough to lead like Aisha Jaco is doing in that organization, but also lead in the medical care, because you're not controlling the hands that go on our bodies. And that's we're in the system that controls the hands that go on our bodies, right? And when we have better outcomes, we control the system that had control of the hands that go on our bodies. That's where our problem is. That's also where our solution lies. That's it. Don't call me. It's not going to change.
I hear you. I hear you, Dr. Meyer. And sometimes what I hear you saying is that let's not put this round hole into this square hole. It doesn't fit right. Yeah, you got to make it. It got to fit the circumstances and the situation. Whatever we do, it still has to fit the people that we're serving. And the square peg doesn't fit that round hole. It's never going to fit right.
But let me ask,
you have to take that into consideration.
How important is individual awareness and education in terms of the role that the individual, that no matter what the system is, no matter what the doctors know, no matter what the nurses know, how important is it what the individual knows him or herself?
Congressman, sorry.
Go ahead, Doctor.
Congressman, it's very important because a person is their first advocate, right? It's very important. It goes in lockstep, I think. I think Tarina, I don't know who was saying it, but awareness of what's out there and what's available is super important, right? Because then you can advocate in that within that system for yourself. And it's also, if we look at Serena, if we look at what happened to Beyonce, I'm naming these people because people know they knew what should have been coming to them. They advocated for what should have been coming to them and put in a system that wasn't working for them. They still had poorer outcomes, you know? So I think it's very important because that's going to be not only knowing what about our own health, that's very important. I think that's going to be the spark. And the more of us that know about it and the more of us that advocate for ourselves in those spaces and through the work, Tarina, that you're doing, making people aware and giving people tools to advocate and things like that, very useful. Aisha Jacob, very useful, you know, and we have to increase the number of people because I think that's going to impact the system. Patient advocacy on a larger scale, not individual, over time tends to impact systems a lot in a more standing way. I'll say this to say, look what happened with, and it's tied together, even though it may sound like it's not. Look what happened with weight loss medicine. It was illegal. People were getting letters. Doctors were getting letters saying, we can't do this. Insurance was saying, we can't do this, blah, blah, blah. The patients in the United States have pushed the system to make it available. It started a healthy community starts with each individual. So thank you for saying that. And if we took that and put that into infant and mortality health, I think we're going to go very far with it. So thank you for saying that, Doctor. Doctor and Congressman Davis.
I think the work the legislation around the increase in funding for things like home visiting programs to have someone professional be providing that care and that education in person while it's happening live and in color, I think will increase the number of folks who are educated about what the expectations of postpartum recovery looks like, are educated about how to care for their babies. So things like that, as they trickle into communities and start to become more utilized, will start to make, I believe, a change in individual education. And I think all of the work that's happening on the outskirts, the ancillary work that is happening with our legislators, with you, Congressman Davis, around addressing those social determinants of health, is, addressing the education gaps in communities, addressing the food deserts and the lack of access to healthy food. I see some questions in the chat about that. I think addressing those things concurrently, because they're occurring concurrently, is the key to shrinking the challenge all at once, for sure.
Well, let me grab those questions you were talking about in the chat. And also a question that we have from Instagram. Well, it's not a question. Buster on Instagram says, listen. And that's how he starts his statement. Listen, I just want to say, we talked about the money. Nikki, I agree. Follow the money from A to Z. And as I follow the money, a dollar doesn't shake unless it comes from Congress. So hats off to Congressman Davis. Everyone else gives themselves credit for all of these funding sources that they bring, but it wouldn't come if it didn't come from Danny. So thank you. And you will have my vote until my eyes are closed. All right, Buster, we are listening. So thank you for the listen. I want to say hey to Beverly, who is here. And Beverly says, good evening, everyone. This is such an awesome discussion. I'm learning so much. As you can hear, my dog is very excited about this conversation as well and will not be quiet. Kevin Newkirk is here, and Kevin says, what about healthy food options? No GMOs for our communities. How are we going to address this? What about the raising autism rates for our Black children? Food is everything.
I'll just comment that we are unlike most countries. Most countries in the world do not feed their population food that has been genetically modified. Most countries do not put those dyes that are commonplace in our food. And if you go to Europe, as an example, you will find that some foods that bothered you in the United States don't bother you over there. If you get a piece of fruit in Europe, it will spoil in a few days, which is what it should do, and it will not spoil if you buy it in the United States. You don't have to buy Debbie Meyer's green bags to preserve your fruit here as much, because we do so much to our food to preserve it, but we do it knowing that it may harm the people who are eating it. So we do have a lot of work to do, and it's not just for our pregnant women, it's for the entire country. And we absolutely know that autism is environmental as much as anything. I mean, I can show you studies, and I'm a keto doc, that'll show if you go to a low sugar, low inflammation diet, you will absolutely reduce your autism risk and or improve your ability to function in the world. So yes, we have things out there that can increase your risk. You have heavy metals, you have exposure to radiation, you have maybe even genetic factors. You got parents who maybe are older when they get pregnant. These are all factors, but what we focus on is not the genetics as much as what can we do ourselves. And I think that as we educate our moms about, and they're very engaged. When I was a young doctor delivering babies, the moms are very engaged because they love their babies that much. So that's the best time. Just like a person who had a heart attack, they're very engaged when they just had a heart attack, right? So if you got a beautiful bundle of joy in front of you and you want to do everything within your power. In fact, that's how I got on my whole nutrition. I started plant-based, now I'm more low carb, but I actually did it in the name of my babies. I wanted to make sure that they had the right nutrition. And Dr. Mason would be proud of me, because the first book I started with was a plant-based book called How to Disease-Proof Your Child by Dr. Furman, I think, at the time. So again, we are very engaged at that stage. So we leverage that engagement so that when we have that person in front of us, we can then say to them, guess what? You can impact this dysfunctional health system. You can, in fact, impact the political system that's not necessarily serving your needs, but it's a grassroots effort. You can't sit on the sidelines. I'm actually going to Washington on Sunday to have it's called metabolicrevolution.org. If anybody want to check it out, me and other doctors are going to get on the lawn of Washington and yell and scream that food is medicine. And you have to do those little things. You don't have to go to Washington, but you certainly have to understand that you have a voice and you can make a difference. And if you, even our congressman knows that if they keep knocking on his door with a certain issue, he can't help but to open the door and deal with that issue. You have to raise your voice and know that your voice matters. Of course, it's hard to compete with lobbyists, right, who have more money. But if you raise your voice, a lot of the issues that we talk about in politics are because people are raising them. And so never give up on your voice, because that's exactly how you can impact the world around you. And I think that with the knowledge of that, people will be empowered to do better and to impact themselves. So going back to the earlier question, the individual has to get the knowledge and then be accountable. There's nobody more concerned about you than you. Maybe Jesus is more concerned, but beyond that, it's you. And you need to understand that you are going to care more about yourself. So let's do something about it and be just as concerned as you should be.
And especially if you get educated first and then raise them because there's some other people raising them in other ways. And they'll swear that they was right.
Well, the one of the things that we always really concerned about when we talk about the food that people eat is people having the appetite for certain foods, and often that is there because they started on another with the wrong things, and they began to develop the appetite for those things, and so it becomes difficult now to get rid of that appetite and get them to the appetite that is really healthy for them. However, mom has is the first person in charge of feeding her babies, and therefore she has the opportunity to make certain that that child, if she's aware, and she has the resources, that she has the first opportunity to make certain that her child gets start to eating those things that are correct, and stay with that, because it's easy for, sometimes, getting the food that the child really needs is, and not just the food that the child wants because they see someone else eating those things. And so those are important things, which again goes back to play into the whole idea of the individual understanding what their needs are and understanding how they can meet those needs. If they don't understand that, then it becomes a different battle, different type of battle to fight.
Well, let me ask you about exercise. I saw some obviously 2 or 3 obviously pregnant women with us on Saturday when we were up in Wisconsin knocking on doors. Were they harming themselves, hurting themselves? What were they doing other than knocking on doors trying to get people to vote?
Exercise is important is an important part of developing and keeping and staying healthy. And so, if they were pregnant women and they were walking, they weren't doing things that would be, overdoing things. I think that those are healthy things. So sometimes, in the midst of other doing other things, sometimes we meet, we're able to do the things that are good for ourselves and while we're doing trying to do good for others. So yeah, I mean, exercise is important, and it's just not just a matter of what you eat. It's not just a matter of what vitamins you take, but the whole process is important. So you can't just say, well, we're going to take out this process, we're going to take out the exercise, and then you eat right. That won't fulfill it. So exercise is important. The diet is important. And avoiding stress is important. All these things are an important part of the whole process that mom is going to go through with during her pregnancy.
And to dovetail off of what Dr. Miller said, it's actually recommended if mom is performing at a certain level of exercise. You know how they say it's levels to this. So if mom is performing at a certain level when they exercise, the recommendation is to keep at that level. If you're not exercising, the recommendation is to go to low impact. But if you're exercising, you're hitting the gym every day, the recommendation is to continue that. Of course, you want to do that and let your doctor know, because all pregnancies are, unique. And so you want to make sure that guideline, that's the general guideline. You want to make sure that guideline applies to your specific, customized, unique, and beautiful pregnancy.
Well, outstanding. Simply outstanding. I know you guys hate to hear me say this, but I got to do it. That's our time. But I want to say hey to Terry Solomon, to Deborah Williams, and also to Derek Tyler, who is here with us just as well. And then Dorothy Murphy says, Dr. Miller, thank you for opening the door and speaking in reference to breastfeeding. Well, Congressman, I'm not trying to tell you what to do, but I know this must be part one, because I have a lot of questions about this that I want to ask. And you're right. I see all of the questions that are coming in. So I know we have to have a part 2, Congressman. Hint, hint. Okay, thank you, Ms. Murphy. That is so sweet of you. And you're right. We have tons of questions coming in. We have questions that are coming in that says, why does it take a year for our families to begin to fall apart? There's a young lady here who leaves a small comment that her daughter was fine up until 9 months after she had the baby, and she has declined. So there is some more of this conversation that we do have to have, and we will definitely pick this up on next week, and we'll begin to share the rest of that conversation with you just as well. However, it is our time, so we're going to go around real quick and do our until next Mondays. Well, Dr. Hampton had to go, but he texted his until next Monday. And his until next Monday says, change is a grassroots effort. It requires the effort of the patient all the way up to the hospital CEO. So whenever you have someone's ear Be sure to remind them that African American babies and moms deserve better infant mortality rates than what was present and what we're doing now. During this time, we can do better, and we can do better. So he says, let's do better. Well, Dr. Graham, what's your until next Monday?
So I've been thinking about the change in this whole space over the last 4 years. And so I've been really kind of thinking about this because we talked about the individual responsibility. But I want to tell you, there were people who studied this and said, we need to extend the coverage because we're having maternal deaths within the first year after delivery. If we didn't know that, we wouldn't know to expand the coverage. Number two, the same thing about doulas. Many people in the medical world didn't know about doulas, didn't know how they work, didn't know their value. Until somebody did the research and published it, there's a complete area of unknown. So I think that this area is dynamic, it's changing, people are concerned. So I'd say stay in touch because it's going to change again.
Outstanding, and thank you so much. Well, Dr. Hampton says we can do better. Dr. Graham is saying extend the coverage and doulas have a place. Well, Dr. Miller, you're until next Monday.
Well, I will just sort of pick up where Dr. Graham left off, is that we got to do better because this is just not acceptable. We have to do better, and we have to bring in whatever is necessary, whoever is necessary, and we have to partake in this process. I mean, we cannot the cavalry isn't coming. We are the cavalry, so we're going to have to address this problem, and we're going to have to do what we can do to fix it. And that is just necessary.
Outstanding. Well, Dr. Maya Green, Dr. Miller says it's not acceptable and we must do better. Dr. Graham says extend the coverage and doulas have a place. And of course, Tony said we can do better. Well, Dr. 100, what do you say?
Well, I'm just also thankful for the insight that we're allowing to happen in these spaces. I'm thankful for Ms. Newkirk making space so people actually are aware of what is available to them. Like the congressman said, being aware as an individual of what it takes to advocate for a health right. Also, thankful for Aisha Jaco and leadership that has the same experiences and backgrounds of our community, and also thankful for the opportunity to recognize leadership in all departments, from the wraparound, from the support and operational, and including the medical is very important. Also, we mentioned doulas, gotta mention what was benefiting our community at the turn of the century, doulas and midwives. So thankful that we know this stuff in the opportunity, dovetailing off, we need to do better. We have to do better. And by including these things, I'm excited that we are doing better.
Outstanding. Well, Tyrena, you're until next Monday. You got a lot to come up with now. That there's some great competition out here because Dr. Hampton says we got to do better. Doug says extend the coverage and doulas have a place. Dr. Miller said it's not acceptable. We must do better. Maya reminded us of those midwives, and knowledge is the key. Tyrena, where we at?
Yes, so I'm just going to echo what all the other esteemed guests have already said, but just a slight tangent. October is also Breast Cancer Awareness Month, and I must raise all up and lift up all of the Black women who are especially struggling with their risk and their diagnosis of breast cancer. This just really hit home for me. My very best friend at 35 was diagnosed with breast cancer after having a poor experience with being uninsured, exploring her options. 3 years later, she got insured and discovered that she did indeed have cancer, and it is now stage 2. So I just wanted to take a moment to lift up all of the women, especially the Black women, and the percentage of men exists as well, men who are dealing with breast cancer.
Outstanding. And thank you so very much for sharing that. It is Breast Cancer Awareness Month, and we have to raise the torches. Remember that if you have not had a mammogram, to please get one. If you're having any difficulties with getting there, please reach out to us and let us know. Well, we can do better. Extend the coverage, and doulas have a place. It's not acceptable, and we must do better. Knowledge is the key. Don't forget the midwives. Breast Cancer Awareness Month. Well, Aisha Jacob, what's your until next Monday?
Yes, I want to say +1, +1, +1, +1 to everything that was said. But I also want to say that this is a block by block approach, community by community. Once we figure that out, it's citywide. This is a national model, the work happening here in Chicago. And so I think one of the things that we want to do is get the word out. There are hundreds, thousands of the young lady who was at that event. So she is a spokesperson, a potential doula, a potential midwife. So we need access also to funding around marketing. We need aggressive marketing to show that these projects do exist. And so I'm raising my hand. We got a catcher's mitt, and if we get access to that, we can help that to make sure there's connection. And we're going block by block, just like back in the day. My people are from Mississippi, and midwife Junie Pam, she delivered the entire community. And so that's the same approach as was mentioned earlier that we have to get back to. And so we have our sleeves rolled up, and we want to do this block by block, community by community, city by city, and beyond.
Outstanding. I shared with the young lady one day. She said, "You don't know anything about the South." I said, "Well, that's not true. Just while I'm living in Chicago, my heels are a little higher. That's about it. My soul is someplace else, and it's in the South." With that being said, I don't want the congressman to think that I was out here practicing the gospel without a license. At this particular meeting, it was an open eye moment because the young lady was sitting right next to a very affluent physician. And the physician, she actually got comfortable enough to whisper in that physician's ear. And that physician began to cry. She was in tears. She got up and gave the young lady's testimony that she had not had any health care. And it was because she was afraid, that she felt like she was going to die the first time. And Congressman, when I tell you the doctors on the panels, the doctors who were sitting in the audience started spewing out, I felt like it was a Dr. James Miller moment, because they began to spew out scriptures across the room. And then we knew that this was a healing for this young lady in many different ways. So it was an outstanding moment. And Aisha, you are correct. She is not the only one. There are 100 clones of her out here. And we have to raise awareness in what we do. Congressman, take us home as always.
Well, I think there are a lot of good health things going on. I'm going to mention a couple of them. One is a retirement celebration for Henry Taylor at the Mile Square Health Center in the Danny Davis room, I think, at 1220 South Wood Street. That's going to be Wednesday from 2 o'clock to 5. Then there's going to be a health piece for State Representative LaShawn Ford at the MedStar. It's a laboratory out in Hillside, Illinois, that same day, 5:30 to 8:30. And if it wasn't for midwives, of course, I'm not sure I would be here because I and all 10 of my brothers and sisters were delivered, and a bunch of them are still around. Some of them almost as old as I am. And then just to let you know that people do live long, we're going to be celebrating the birthday of Miss Lillian Drummond, who will be 103 years old. And we're going to do that on Friday. So there are a lot of good health indicators. And I was happy when I went to the clinic today and had my blood pressure taken, and it was 119/76. And I thought that was pretty good for a guy my age. And so I felt like jumping. So thanks to everybody. Thanks to each one of us, because the healthier we are as individuals, the greater will be the health status of our community. Have a wonderful evening. Hope to see you somewhere during the rest of the week. Thank you so much.
Outstanding. And Congressman, the Black Fire Brigade says that they are in the firehouse watching, that it's my fault. I forgot to mention them. I apologize. They are here.
Well, we
All
can't
right.
do without the fire brigade. All
Good night,
right.
everyone.
Thank you all.